I'd now like to introduce the co-director of the New England MHTTC, Maria Restrepo Toro.
Thank you, Dana, and good afternoon, everybody. On behalf of our New England Mental Health TTC, we welcome all of you. With me today is my colleague, Ingrid Paget. Ingrid, would you like to introduce yourself?
Hello, everyone. Thanks for joining us today.
The Better Together and the New England Mental Health TTC has a fabulous team that are here with us today. That is Dana, which you met, Drs. Martha and Milena, and they are here to join us and do the sessions with us today. So welcome, everybody. Just to give you a quick update what's going to happen in the next hour, we're going to be talking about racial equity and social justice across the New England Mental Health TTC network. A little bit, I'm going to give you a background if you're not familiar with our network. And then we're going to jump into the goal of the presentation today, which is to learn from you and to hear from you what are your needs in your different organizations to help you advance racial equity and cultural humanity. And we're going to do actually some interactive work. So we're going to be doing some breakout sessions that are going to be facilitated from our members of the REACH work group from the New England Mental Health TTC. Just to give you a little bit of a background, the New England Mental Health TTC is one of the 10 networks, national networks. The mission of our center is to really disseminate evidence-based practices across the 6 states of New England. And our area of expertise and what we embrace in all the practices and projects we do is recovery-oriented practice, including pre-support and peer services. Please visit our webpage to learn more about the wonderful programs and initiatives that we have. Therefore, in every work we do and this is going to be actually throughout this REACH Learning Collaborative as well, we really embrace our guiding principles of resilience and recovery. We provide activities that are based on resilience and respect, that emerge from hope, that are family and person driven. We understand that recovery occurs in many pathways, and we highly value community-based through collaboration, and we have been able to establish a great network throughout the New England region, and throughout this work, we expect to do exactly the same. We completely value and support and are very intentional in working with all the peer supporters, a resilience network. We understand that recovery is culturally based and is informed by culturally based practices, and we also understand that's responded by strengths-based processes and trauma-informed. So just to give you a big overview of how we provide our assistance. So we are funded by SAMHSA, and I did mention we are doing this project in collaboration, the Yale Program on Recovery and Community Health, which is where we are working in collaboration with C4 Innovations and Harvard Department of Psychiatry. For the network, and this is the same for our region, we provide free training and technical assistance to all the stakeholders in the region. What we like to do is we're mandated to do is provide what we call universal training technical assistance, which is really publications, newsletters, presentations, a website, media. So please visit us and follow ups. We have wonderful resources free of charge for you to look. We also do something that's called targeted technical assistance, where we provide a series of webinars, sharing knowledge for a limited amount of time. We provide training tools, materials, and everything is available for you. And then we provide the intense training technical assistance. And that's the kind of intervention we're here to talk about you today. So the Mental Health TTC Network, and in particular our New England Mental Health TTC Network, is being intentionally committed to advance justice, health equity, and racial equity throughout our region. So we are committed not only internally to learn about how we do this process, but with all of you visiting us today to address all the employment, housing needs, all the social determinants of health. So we are very committed as a network to address these issues, and that's the program we're going to be talking about today. So I'm going to turn it over to my colleague about our vision. Ingrid?
Hi again, everyone. So what's our vision around racial equity and cultural humility? We really want to work within our region to build community, to hear your stories, to learn more about your needs, and create equitable partnerships and lasting relationships throughout the region. You can go to the next slide. We know that there's a compelling and urgent need for this kind of work right now. SAMHSA's Office of Behavioral Health Equity notes, and we can kind of read along with this together, that the COVID-19 pandemic, economic crisis, and widespread racially focused protests have highlighted glaring inequities for racial and ethnic minority communities. These crises have significant implications for mental health and exacerbate already poor access to behavioral health services in BIPOC communities, Black, Indigenous, and people of color. We really see this as a call to action and want to assist you and your organizations and agencies as you examine how societal issues, including those within mental health and other systems of care, are impacted by disparities, racism, and inequality. We really want to walk with you on this path to equitable and resilient communities. And so as you consider reviewing possible reforms, maybe considering possible partnerships, we have a poll that I think we can point to so that you can kind of tell us a little bit more about what your organization is doing currently to address racial equity and social justice issues. You can answer yes or no, but then if you are doing something that you'd like to share, please add that to the chat. Dana, can you launch the chat or the poll? I'm sorry.
I've launched it and there's been 11 people who voted so far.
Oh, great. I can't see the outcome, so if you can help with that, that'd be great.
Okay, sorry.
Okay, so it looks like quite many of you, 93%, wow, that's great, are currently working on addressing these issues. So looking forward to looking at the chat to see kind of what you're doing in your areas. Maria, do you want to go to the next? Okay. So as I said, you all are doing some great work, I'm sure, in your areas and organizations. We'd like you to kind of take a seat at our training table, no matter where you are on this journey. Our REACH for Organizational Change Learning Community, and REACH is an acronym that stands for Racial Equity and Advancing Cultural Humility. Our program is grounded in our principles of recovery, as Maria has shared, and designed for the workforce supporting behavioral health needs in New England. Our mission is in the name, right? We want to help you reach for organizational change to really ensure the development and implementation of culturally responsive and humble practices with diverse individuals and communities in the New England region. As Maria shared, there are 3 ways to engage via training and technical assistance opportunities. So universal, targeted, and intensive. If you go to the next slide, you can kind of take a look at what universal TA looks like. It's really designed to help you increase your overall awareness around a particular topic, perhaps over the course of 3 to 6 month period. So that would provide you with access to publications and resources, as well as invitations to join and engage and network via our learning community. If we go to the next and take a look at targeted TA, it's really designed to kind of gain and apply basic knowledge. So to take the next step after universal training. That would look like access to individualized technical assistance, access to learning collaboratives and communities throughout the New England MHTTC, and then networking and ally development support through our BIPOC resource directory. And then Maria, if you'd like to go to the next slide and talk a little bit more about our intensive training and technical assistance, our REACH Organizational Change Learning Collaborative.
Great. Thank you so much, Ingrid, for a great overview. And then the last and the most important one, and the one we're here today, is called REACH. That's the kind of tech training and technical assistance that is more intensive. And what we mean by intensive is that we're going to be able to provide some didactic information, but then we're going to be providing individualized technical assistance. So the way that the learning communities work is we will do monthly consultations with each agency, because I think, as we saw, this is a journey. There is no destination. Every agency, every community, based on whatever needs they have, is going to be working towards this journey with their team. This is a team effort, and what we're envisioning is, through this work of learning together, we're going to be able to provide you with different resources and point you in the direction that we can help you create an individualized class for your specific organization. So for this kind of, but in order for us to really learn more about, provide really high quality training and individualized consultation, what we really need to do is we need to understand from you. We need to learn what is it that you in your agency, because it sounds like for the poll that you responded, a lot of you are already in this journey. So we're going to be here to complement efforts and help you increase skills, and perhaps maybe redesign policies or examine different potential barriers that may exist for you in this journey. So all of our members of our committee are going to be working individually with the teams. And we have done in the previous year other learning collaboratives, both under the school and also as well as in our mental health TTC. But for next year, this is going to be our learning collaborative.